Today we're going to talk about DBQs and how to best use those to benefit your claim. Hi, I'm Melissa Alexander, a VA Accredited Attorney with Woods & Woods, a VA disability law firm. So a DBQ, and that's Delta Bravo Quebec, and that stands for a Public Disability Benefits Questionnaire. And DBQs are VA forms that doctors use or medical providers use to collect information that they need to process a veteran's claim. However, it's not just a form for the VA to use. This is actually a public form that private healthcare providers can fill out. DBQs are additional evidence that can be provided to support your claim. There are about 70 different DBQ forms to use based on the veteran's condition, symptoms, or diagnosis. DBQs are important because if the VA grants service connection, this is usually the main piece of evidence that the VA uses to determine a veteran's disability rating based on the symptoms and impairments that are noted on the DBQ. The forms typically include sections for the medical providers to discuss the veteran's diagnosis, the veteran's medical history, the veteran's symptoms, how a veteran's disability has progressed since it began. It includes past and current medications. It can include the methods used to treat the disability, maybe such as physical therapy. There's also a place for the examiner to provide statements about how this disability affects or impacts the veteran's overall health and ability to live a normal life. C&P exams are performed by medical providers that work for the VA or are contracted to the VA. These providers use those DBQ forms during the C&P exams to guide the process. A veteran will want their DBQ to be as accurate and thorough as possible. We want as many details about their disability. We want it to represent the full extent of disability. This is because the DBQ helps determine the veteran's rating and ultimately what a veteran gets paid. Sometimes when you go and report to your C&P exam, maybe your disability, whatever it is, if it's your knee, maybe it's not hurting you as bad as it do. Maybe because you suffer a lot of flare-ups and you're just not having a flare-up that day. So it's important to describe to that examiner, what it's like, what you experience when you have those flare-ups. Unfortunately, VA examiners often rush through these C&P exams, and sometimes C&P exams occur without the veteran present, and the examiners fill out the DBQs based on the treatment records in the veteran's C-file. So having a private physician complete a DBQ can fill in any gaps. Around 2021, the VA approved the public use of DBQs. Before that, only VA or VA contracted providers could complete these forms. But today, any medical provider, including a veteran's primary care physician, can fill these out. It's probably best that a medical provider fill these out rather than like a nurse practitioner, because the VA may find that the information provided is more valuable by an MD. Now, a veteran's primary care physician likely knows the veteran's conditions the best. He has the complete knowledge of the veteran's medical history and background, and a veteran also probably feels more comfortable talking to their own private physician. So it's a great idea to have them fill those out. And so in the top portion of the DBQ, there's a section that lists the criteria that is required for a medical provider to be able to fill those out and it be accepted. If it's an area of specialty such as cancer or mental health, the DBQ should be completed by a medical provider who's qualified in that area. It's also important that when you take these to get filled out, that you make sure that the medical provider signs and dates and includes their licensing information on these, because the VA will or can check and verify this accuracy. I want to point out that it's not something that's required for a veteran to do to go out and get their own DBQ, but it's just great additional information or evidence that you can provide to support your claim. Sometimes if you have a physician fill out a DBQ and you submit this, you also may be required to attend a C&P exam. Sometimes the VA just requires that, and you need to make sure you go to those. It's also important to know that if a private provider is completing the form, that the VA is not going to reimburse the veteran for any expenses that they incurred when getting these forms filled out. When Woods & Woods takes a case, we initially pay to obtain a DBQ or medical opinion to support a veteran's case. If we don't win a client's case, then a client does not owe us anything. If we do win, we collect those expenses on top of the percentage of back pay. So DBQ forms can be found online and from our Woods & Woods website. Sometimes finding the current forms online can be hard to do because the VA updates the forms periodically. And it is possible that the VA will not accept an out-of-date form if it's used and submit it. So it's important for a veteran to make sure they check our link at Woods & Woods for an up-to-date downloadable form before they take it to their physician to get filled out. And you can find links to that in the box below. You can learn more about DBQs by following the links in the description box of this video. And if you have more questions about VA benefits in general, watch some of the other videos on our YouTube channel. You can also leave your questions in the comment section below, And if you're wondering if you qualify for 100% or TDIU, contact Woods & Woods for a free consultation. Click the contact page in the description box in this video or call us at the number on your screen. Thank you.